of the functional medicine tests that I get on my patients is a stool test, either a GIFX test or a GI map test. These are from two different laboratories, and they have pretty much similar information. What this detects for are several things: how someone's digestive system is working, whether there's inflammation going on, whether there's infection, whether there's what we call dysbiosis, which is a lack of balance of the good and bad bacteria, and also whether there's a metabolic imbalance, which is what are those bacteria producing, and are they producing too much or too little of what they should be producing? The people that should get this test is pretty much everyone, depending on what you're looking for. If you're looking for pure prevention, it's an excellent screening test to look how your gut health is. If you have GI complaints, that is bloating, abdominal pain, change in bowel movements, whether it's diarrhea, constipation, then this test can look for underlying sources of the problem. When people have certain symptoms that may not be GI or gut related, such as headache, emotional issues, recurrent infections, sinus problems, many times the gut can give you clues as to the underlying source. Because when the gut is awry or dysfunctional, it can cause problems in other parts of the body. The instructions that come in these kits can be a bit complicated because we're not used to reading these things, and I would highly recommend reading it over several times, making sure the tubes are correct, and that you eliminate certain things prior to the collection. Some common things to eliminate are probiotics and prebiotics that you might be taking in the form of a supplement. If your health is going to be hindered by stopping these, naturally speak to your physician so you can work something out to get a valid sample. The other thing that can sometimes be a hindrance are medications called proton pump inhibitors, such as Prilosec, omeprazole, pantoprazole, Protonix, things like that. Also, the use of antibiotics. The best way to collect this sample is with your first morning bowel movement, or if you're someone who goes later in the day, it really doesn't matter what time of day, as long as it is a typical bowel movement that you're having. If one day you wake up and you have abdominal pain with diarrhea, that's not the day to collect your sample. Interpreting the test can be very, very involved. It's important to have it interpreted by your physician who understands the way that these results relate to your medical history. And if you have any questions about them, write them down. Both your time and the physician's time are equally valuable and should be respected at the time of the visit to get all those questions answered.